Intervention radiology has a role in the management of early pregnancy complications زي حالات gestational trophoblastic disease. Gestational trophoblastic neoplasia is associated with excessive neovascularization and arteriovenous malformations. And rarely, this malignancy can invade through the uterus and vasculature, leading to life-threatening bleeding. Life-threatening bleeding may indicate hysterectomy. To preserve the uterus, selective embolization is increasingly used as an alternative to hysterectomy. Selective embolization may be a standalone يبقى هو التريتمنت لوحده أو ممكن نستخدمه prior to conservative surgery. على الانديكيشن الثاني ده عندنا كيس ستادي استخدمت embolization and conservative fertility sparing surgery. بيوصفوا حالة 19 years old at 9 weeks presented with intermittent bleeding. بيتا اتش سي جي عندها كان 100,000. ultrasound كان فيه tiny cyst numerous tiny cyst associated with distorted empty sac and slight fluid within the uterine cavity, finding suspicious of molar pregnancy. عالج الحالة as usual with suction evacuation. Beta HCG dropped to 5,000. However, during follow-up there was an increasing trend of beta HCG. لما عمل ultrasound heterogeneous vascular uterine mass with possible myometrial invasion. MRI and CT were consistent with ultrasound finding, and there was pulmonary nodule seen in the upper lung lobe. هو للأسف ما حطش صور لكل الراديولوجي اللي هو عامله ده. A plan was made for systemic chemotherapy. وبدأ فعلا السيستميك chemotherapy with methotrexate and folinic acid. The patient was discharged home in a stable condition, but 3 hours later she returned back with dizziness, lower abdominal pain, vaginal bleeding, hypotensive, tachycardia, and hemoglobin was 6.7. The patient was resuscitated with intravenous fluid, admitted to high dependency units, and transfused 2 units of blood. Ultrasound of the abdomen showed moderate hemoperitoneum. Another 2 units of blood were given, and CT angiogram was performed to assess the site of bleeding. The CT scan showed focal discontinuity of the uterine outline at the superior aspect of the hypervascular myoma mass. لو كان هنا في اليوترس الجزء اللي فوق ده فيه discontinuity above the hypervascular myoma mass. And there was massive hemoperitoneum. A decision was made for emergency laparoscopy. But because of the possible need for hysterectomy, a bilateral uterine artery embolization was performed in order to reduce the amount of hemorrhage intraoperative. دي صورة الانجيوجرام before embolization and after embolization. After that the patient was transferred to theater. كان فيها هيموبروتينيوم حوالي 2 لتر, and there was a 2 cm perforation at the uterine fundus with a protruding vesicular tissue. دي صورة الانتراوبراتيف فايندينج وشايفين فيه defects وشايفين فيه الماس اللي طالعة من اليوترس. An elliptical incision was made around the mass. لكن هو للأسف مش مدينا صورة للoperative intervention. And the tissue was excised as a wedge resection. بعد كده عمل repair لليوترس in layers, interrupted sutures للdeeper layers and continuous suture in the serosum. Pathology report was suspicious of invasive mole, and post-operatively the patient continued on methotrexate chemotherapy. And there was a good response to treatment with negative HCG value after cycle 7. 2 years later the patient conceived spontaneously. Intervention radiology برضو can be used in the management of ectopic pregnancy. For example, it can be used to control bleeding associated with non-tubal ectopic pregnancy زي حالات cervical ectopic pregnancy. في cervical ectopic pregnancy selective embolization control bleeding and avoid the need of hysterectomy. So it can be used with systemic methotrexate. In this condition, intervention radiology is associated with some complications such as uterine infarction, necrosis of the bladder and rectum, nerve injury, and infection. تعالوا نشوف كيس ستادي استخدموا فيها uterine artery embolization and methotrexate في علاج حالة cervical ectopic pregnancy. Cervical ectopic pregnancy is a rare form of ectopic pregnancy, and several management options have been described. على سبيل المثال medical management with methotrexate with or without potassium chloride. لكن مشكلة كبيرة في المانجمنت of cervical ectopic pregnancy if the medical management fails or the patient hemodynamically unstable then hysterectomy is indicated. ومن هنا جاءت فكرة إن إحنا ندخل الانترفنشن radiology to control bleeding بدل ما نعمل hysterectomy. So uterine artery embolization is a novel treatment approach for women who wish to preserve fertility. الحالة بتاعته كانت cervical ectopic pregnancy. شايف الجستيشنال ساك وجواها pulsating fetal ball موجودة في posterior wall of the cervix. And due to hypervascularity of cervical ectopic pregnancy, it was recommended to perform uterine artery embolization. And both uterine arteries were embolized with gel foam. Post-embolization images were satisfactory. هنشوف هنا الإيمج ده الانجيوغرافي before embolization and angiography after embolization. بعد اليوتراين artery embolization the patient received intramuscular methotrexate 1 ملغ per kg on day 1. بعد ما خدت الميزوتريكسيت vaginal bleeding stopped, HCG dropped بقى 16000 and vital signs remained within normal limits. في اليوم الثاني أخدت folic acid. في اليوم الثالث she received a second dose of methotrexate and was discharged home with no further bleeding. follow up على اليوم ال 35 HCG was negative. في اليوم ال 51 البيشنت كانت في العيادة بتركب intrauterine device. يبقى ده مثال مع السيرفايكال اكتوبيك بريجنسي. المثال الثاني هو حالات الهيتيروتوبيك بريجنسي لما يبقى في intrauterine pregnancy and ectopic pregnancy الاثنين مع بعض. Medical management by means of ultrasound guided injection of hyperosmolar glucose into the sac or potassium chloride into the fetal ball or sac with aspiration of the content is an alternative to surgical management.